I'm Rick Buck, and I've been a dentist for 16 years, and I've been taking out wisdom teeth for 13 years. In this video today, I'm going to show you how I take out 4 wisdom teeth that are soft tissue impacted, which means they are at least partially covered by gums. As a dentist, I don't put my patients to sleep for wisdom teeth extractions, and most people do just fine without being put to sleep. I only get them numb. Today I'm going to do a special injection, and the injection here is I'm just going right into the tooth follicle itself. This way, the tooth is swimming in anesthetic. And now that they are for sure numb, I always start with the easiest extraction. Normally for me, that is the upper right wisdom tooth. And today I begin this extraction in essence by making an X-shaped incision right on top of the gums, right over the tooth, all the way down to the tooth. I then start to reflect or pull back the gums with this periosteal elevator, separating them from the tooth and bone with that periosteal elevator. Now, after you've done a few of these wisdom tooth extractions, you can pretty much feel the wisdom tooth without even seeing it. And that's kind of what I want to show you on some of these today. I do this by sliding this instrument called the elevator down the distal buccal of the tooth in front of the wisdom tooth until I can feel the tooth with the instrument. And you can feel it because bone feels kind of more rough and the tooth will feel kind of glassy when you slide this instrument over it. Then I can feel where there's kind of a gap between the two teeth as you would naturally have between any teeth. And so I start by wedging my elevator in between the wisdom tooth and the tooth in front of it and prying the wisdom tooth by rotating the elevator. Now as I'm doing this, if you look closely, you can see a little bit of the wisdom tooth here and there. But it is really loose now and I'm able to get my instrument far between it. So I switch my instrument to what we call a Potts elevator, and it has a T-bar handle. Since the wisdom tooth is now so loose, I can wedge this instrument all the way and wrap it around the back of the wisdom tooth. And then when I rotate that T-bar, you're pulling it up and outwards towards the cheek. And that's the preferable direction that you want to extract any tooth for that matter. Now you may be noticing that this tooth is loose but not coming out, and it looks kind of funny, almost like the mouth is giving birth to the wisdom tooth. I could have made this easier on myself today by making another releasing incision up the second molar, but I wanted to show you how you can extract most upper wisdom teeth by mostly kind of just feeling where the tooth is once you know what you're feeling for. And keep in mind, I do like to look at the wisdom tooth, but once you know kind of what you're feeling for, you can completely do it by just feel alone. So then I kind of just change the direction of the Potts and the elevator so that it gets under the tooth so I can just lift it straight out and it doesn't have to come that direction where it looked like the mouth and the gums were giving birth. Now we're moving on to the lower wisdom tooth on the same side. Typically, lower wisdom teeth are much more difficult to remove than the upper wisdom teeth. The incision we make on lower wisdom teeth is crucial because you don't want it to extend too far and cut any important nerves, which can run really close to where we're going to be cutting. So we make a cut along the ascending ramus, and we do that until we reach the wisdom tooth. Then you can make an incision along the buccal of the tooth. You then tease the tissue back. And by tease, sometimes I mean you gotta put a lot of pressure to tease it back. And I only pull it back as far as I need to, and I have found that the patient gets less swelling this way. Now looking at the tooth we're extracting, you can now see the top of the tooth and the bone in front exposed while I am doing this. Now that it's exposed I'm going to make a trough in the bone with the drill, and I do that in front of the wisdom tooth. All that bone in front of the wisdom tooth is safe bone to drill away. Now, you will want to only move what's prudent, but it is safe to drill there. If the wisdom tooth is angled forward, I trough the front portion of the wisdom tooth as well. So that way I can get my elevator that you saw in the first extraction right in between these teeth. I then start to pry with that rotating force again, and you can see 2 things here this time. The front piece breaks loose of that wisdom tooth because I made a slot in it with the drill, and the rest of the tooth starts to move up and backwards. Quickly, before I get into the most interesting part, I developed the best toothbrush, floss, and other dental products that are in Amazon affiliate links in the description. And these dental products are more advanced and will give you a stunningly clean mouth. You should watch my videos about why they are the best posted at the end of this video so you brush and floss with superior results that avoid gum disease, cavities, and give you fresh breath. Now there's a loose piece in between the wisdom tooth and the tooth in front of it, so with a slim root tip pick, I remove the broken front portion of the tooth that I broke on purpose, by the way. Now, as you will see, the tooth has a lot more room to lift up. Now I want to switch things up, so I put pressure in different directions. So I switch my prying from leveraging off the tooth in front of the wisdom tooth, and instead I use the bone where we made a trough on the cheek side of the wisdom tooth. But I do keep going back and forth between the two, switching the angles of the pressure. And you will see that the tooth has a nice pathway out as I'm doing this. It's loosening pretty easy because the patient is young, and it's easier to remove wisdom teeth on young patients. And that is one of the reasons why we do it on patients that are pretty young, in their teens to early 20s. So now that it's lifting up quite a bit, I take my root tip pick and position it so it can get under the tooth, especially if the gums are blocking it. And that way, when I'm under the tooth, I can control the direction of the wisdom tooth a little bit better. And so I'm sliding it just in that spot where the two roots kind of go their separate ways. I don't always do this, but when I want to control the direction of the tooth coming out, and since I don't pull the gums back that far, I like to do it this way. And you can see just that. I was able to extract the tooth without going too far behind the wisdom tooth. And once again, this is not always the case, but I always like to try this first. Now I'm going to move on to the other side, and it's a little bit different, but you get the gist of it, so I'm going to go a little more quickly since you already have seen this side. So I'm going to do the same techniques as before, an X-shaped incision, then I pull back the tissue, then I slide the elevator down the molar in front of it until I can feel the gap between that and the wisdom tooth, and then I'm going to rotate the elevator to pry the tooth more and more. It may slide a little bit, it may not, but as it catches it and pulls it more and more, I can then wedge it further and it gets a better grip on the wisdom tooth. And then eventually I can just use that T-bar POTS elevator to pull the tooth up and out towards the cheek side. Now, as you watch me do all those steps, I have two important notes. If I have the patient close down halfway, I can pull the cheeks further back when I'm working on the top wisdom teeth. And though it may not seem this way, I can actually see a little bit better if I can pull the cheek further back as opposed to having them open further. Plus, you already know the part I need to see mostly is where I'm putting this elevator, and so when I pull the cheek back, I can see that better when I have them close halfway. And this technique of having them close halfway will also save their jaw opening strength for lower teeth, which I'm going to do later. And the second thing I wanted to make note of is the reason that I start with the easiest wisdom tooth. And that's because patients normally have a moderate amount of anxiety about wisdom teeth extractions. You can just feel the tension in the air when they come in for the appointment. Their anxiety normally subsides quite a bit faster and quite a bit more if you can get it out quickly. And since I showed you that the wisdom teeth on top come out a little bit more easy, I always start with that one. With the lower right wisdom tooth, we do things mostly the same as the other side. While I avoid pulling the tissue too far behind the molar wisdom tooth, unless I absolutely need to, because once again, sometimes there's some important nerves there. We then make a trough in the bone on the cheek side of the wisdom tooth so we can fit our elevator in there. And because the wisdom tooth isn't tilted forward towards the front of the mouth, we will see if the tooth will come out without having to drill or break the tooth at all. So we use an elevator between the teeth and in the trough to elevate the tooth. Once the tooth is pretty much loose and only the tissues are holding it in, we take a root tip pick and get under the tooth for more control over how we elevate the tooth, and you can see the tooth comes right out. We then flush the sockets with ozonated water, which has been proven to protect against bacteria and also reduce post-operative pain. Not get rid of it, but it tends to reduce it a little bit. Then we put in gel foam to promote clotting of these sockets, and then a resorbable suture to close everything up where needed. So this is how I conservatively remove wisdom teeth to avoid as much pain, swelling, and risk of nerve damage as possible. Honestly, wisdom teeth extractions are my favorite procedure. It takes a lot of problem solving in real time, which is fun for me, but honestly, most of the wisdom teeth extractions are pretty simple, like this one. Now, that being said, full disclosure, I refer all the really difficult extractions to the oral surgeon, so I may have a little bit of a skewed perception on that. Watch all my daily tooth care videos I have posted now for the best technique, tips, and products for a stunningly clean mouth that avoids tooth decay and gum disease and gives you fresh breath and white teeth. My dental products are in Amazon affiliate links in the description below this video. If in Southern California, my dental office is in the description as well. Like and subscribe to my channel if you have teeth.